Hello everyone, it's Dr. Nikki, the board-certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. In today's episode, I will be talking about urinary incontinence. Urinary incontinence simply means that you leak urine. Alright, you leak urine. It's very common among women, it's very common among older patients, but sometimes we do see urinary incontinence among middle-aged patients and also even younger people, but it's very common among women. Before we go into urinary incontinence, let us talk quickly about the urinary tract system. So we do have the left and the right kidneys, right? And then we have a tube, kind of like a tube that carries the urine to the bladder. Ureters, we have the left and the right as well. They connect to the kidneys, all right? So they carry the urine to the bladder, and then we have the muscle to keep the bladder closed, because when the bladder is a storage system for the urine, right? So the bladder stores the urine, and then the bladder is closed, all right? So there's a muscle that keeps the bladder closed, and then when it's time for you to urinate, the bladder opens, all right? That muscle relaxes rather, and then the urine comes out through the urethra. So the urethra is a tube that leads outside your body, brings the urine outside your body. So the urethra is the conveyor of the urine outside when you need to urinate. And so there's also a nerve. There are nerves there that tells the brain that a bladder is full. There's nerve that tells the bladder to open. So remember I said that when the bladder stores the urine and it's time for you to go, there's a nerve that tells the bladder to open, and there's a muscle that keeps the bladder closed, and there's a nerve that tells the brain that the bladder is full as well. So once you have the signal that the bladder is full, then it opens up, and then the urine comes out through the urethra to the outside of the body. So whenever there's a problem, whenever there's an abnormality in the urinary tract system, you may have urinary incontinence, meaning if you have a nerve problem and you have issues and you cannot control your urine, you may suffer from urinary incontinence. Some people, after a spinal cord injury, depending on what part of their spinal cord is affected, they may have chronic urinary incontinence, total urinary incontinence, meaning the urinary tract system is not working as it should. All right, so I just wanted to point that out because it's very important for us to talk about that. All right, and so now we will go back and talk about urinary incontinence. So as I said before, urinary incontinence just means that you're leaking urine. You are leaking urine, all right? And by accident, all right? So we do have different types of urinary incontinence, and I'll go over that in a little bit. It's very common among women, as I mentioned before, older women, but as I said, some people even middle age or younger could suffer from urinary incontinence as well. All right, so the causes of urinary incontinence could be the weak bladder muscles, it could be overactive bladder muscles, it could be weak pelvic floor muscles. And weak pelvic floor muscles could be due to things like, multiple pregnancies and things like that. All right, so some people have vaginal infections or irritation, some people have constipation, some people have your history of urinary tract infection, and that is what is causing their urinary incontinence. All right, so sometimes some people have urinary incontinence for temporarily, like just for a while, and then once the situation or underlying cause is resolved, then they stop having urinary incontinence. But some people it's a chronic condition for them, and it's long term. All right, but some people it's short term, and it just happens lasts for a very short time. All right, but if it lasts longer, it might be due to the weak pelvic floor muscles that I mentioned, the weak bladder muscles, or the overactive bladder muscles. All right, and then sometimes also, as I mentioned before, it could be due, if it's long-term, chronic, it could be due to damage to the nerves. Remember I said there's a nerve that tells your brain that your bladder is full, and there's one that will tell the bladder to open up, that urine wants to come out. And so if there's damage to the nerves that control the bladder, such as with diseases like diabetes, with diseases like Parkinson's disease, multiple sclerosis, and then we do also have enlarged prostate in men. So for men, we have enlarged prostate. That's a big one for men. Yeah, that's a blockage from an enlarged prostate in men can cause urinary incontinence, and then other diseases as well. All right, and then we have other causes such as pelvic organ prolapse. So when we talk about the pelvic organs, we are talking about the uterus. So that's the womb, and we're talking about the rectum, and then we're talking about the bladder. All right, so once these organs shift out of their normal place, they can cause problems. All right, so they shift out of their normal place into the vagina. So we say prolapse, and if they've dropped, kind of like they've shifted out of place. All right, so when they're out of place, they're not working as they should, and they may cause urine to leak. All right, so as I said before, for men, because this is a very common problem in women, but for men, the most common cause is the enlarged prostate that I talked about, or incontinence in men is related to the prostate gland. So we do have the BPH, which is a benign prostate hyperplasia. All right, or the enlarged prostate, and then we do have injuries or damage to the nerves, as I mentioned before, or muscles even from surgery, and then we have inflammation of your prostate gland or of the prostate gland, which is prostatitis. All right, so those are the causes in men. All right, so how do you diagnose urinary incontinence? How is urinary incontinence diagnosed? The best thing to do is for you, if you start leaking urine and you don't know the cause of it, you should please seek help. Go to your primary doctor, go to your family doctor, and talk about it. They will do a medical history, a physical examination. They will ask you a lot of questions about your symptoms. They will ask you a lot of questions about the medications that you're taking, about your medical history, medication history, physical examination, so that they will be able to know if this is due to an underlying problem or not, and they will be able to guide you appropriately on the plan of care or treatment plan. All right, so please be open to let your doctor know what types of medication you're taking, both prescribed and over the counter. Some people still do not mention their over the counter medications to their doctor. It's very important because that may help you a lot. Let your doctor know if you're taking any kind of supplements, any kind of over the counter medication, because it may be interfering with what is going on with you. Alright, so once all this is done, they might do a urine test, a blood test to check if you have diabetes, check your urine, and also they may do some tests that measures how well you empty your bladder as well. Alright, and so if needed, your primary doctor or family doctor may need to refer you to a specialist. Yes, you refer you to a specialist who is a urologist. So a urologist is a doctor that specializes in the urinary tract system, like urinary tract problems. The urologist can help, and also some people get sent to OBGYN if it's a OBGYN issue as well. So yeah, you may be referred to a urologist who is a doctor that specializes in urinary tract problems, or you may be sent to OBGYN as well. Alright, so let us talk about the types of urinary incontinence that we have, and then we'll talk about the treatment. Alright, so for the types, we have stress incontinence, we have urge incontinence, we have mixed incontinence, we have total incontinence, we do have overflow incontinence, and we have functional incontinence. We have quite a bit. Alright, but the common ones are stress and urge incontinence, and I'll tell you what those are. So for urge incontinence, this happens when there's a sudden need to urinate and you cannot hold that urine long enough to get to the bathroom or the restroom or the toilet. Alright, so you feel you want to go, but before you get to where you're supposed to go, you start leaking the urine. Alright, pretty much that's what the urge incontinence means, meaning you have the urge, but before you could make it to the restroom or the toilet, then you leak. Alright, and so some people It's just due to a weak pelvic floor muscle. As I said, the bladder is unable to hold the urine, long enough for you to get there. And so some people, they might have urgent incontinence from medical problems like diabetes, Alzheimer's disease, Parkinson's, multiple sclerosis, and even stroke. All right, and then stress incontinence. Yes, we have stress incontinence. People that cough, sneeze, laugh hard, they may go through that. Some people, when they exercise a lot, cough, sneeze, laugh, or even if they lift heavy objects, they suffer from stress incontinence. So pretty much that's when you put a lot of pressure on your bladder. So that's the stress. You put stress on your bladder and you have incontinence that way. We do see this a lot in younger middle-aged women, and sometimes it begins at the time of menopause for some people. Alright, so stress incontinence is very common. Urgent incontinence is common. We have mixed incontinence, which is a mixture or combination of the other ones, and then we have total incontinence, meaning that you cannot even hold your urine at all. You're totally incontinent, meaning there's no, you just go and you can't control it. So they have to put adult diaper on you or a pad or something, because you cannot control your urine at all whatsoever. Alright, so let us talk about treatment for urinary incontinence. So, depending on what the cause is, remember I said that you need to go to see your primary doctor, get a referral if needed, and we have to figure out what is causing your incontinence, if there's underlying problem involved, and depending on what it is, then that will be the plan of care, for you. So, some people, the treatment may be just simple lifestyle changes. Maybe they drink alcohol a lot, maybe, and alcohol is a diuretic. Maybe they drink alcohol or caffeine a lot. Caffeine and alcohol, they're diuretic, they will make you go. So maybe that's what they just need to turn it down. Quit. If you can't quit alcohol or tobacco use, you want to limit the amount. Maybe that's all you need to be able to control your incontinence. So as I said, lifestyle changes is very important. So if you do suffer from incontinence, you may just have to change your lifestyle. All right, and then we have some people, maybe the medication that they're taking is what is causing the incontinence. You may have to tell your primary doctor or family doctor that you're taking a certain type of medication, or if you were prescribed a new medication and you started having incontinence, you need to let that prescriber know that, hey, I'm having incontinence as a side effect of the medication that they gave you. All right. And so we also have so lifestyle is very important as a treatment for urinary incontinence, lifestyle changes, and so depending on the type of the problem that you have, they will guide you appropriately to give you the best treatment plan. So for pelvic floor muscles that are very weak, I mentioned before, some people have it because they've had multiple births and the pelvic floor muscle is weak. So we tell them to do Kegel exercises. Kegel exercises is very, very common and it works a lot for people. So Kegel exercises work the muscles that you use to stop urinating. So it makes the muscle stronger, because then once it's stronger, it helps to hold the urine in your bladder longer. Alright, so you want to keep the urine in the bladder longer because you do not want to have incontinence. Alright, so that is what Kegel exercises does, and you can also Google that too to see how they do the Kegel exercises. Alright, so that is to make your pelvic muscles stronger. Alright, and then we have timing your urination. Yes, timing the time that you urinate or void is very important as well. Some people, that's what they need to control their bladder. So they time themselves, like, okay, maybe 8 o'clock, 11 o'clock, 2 o'clock, like that. They time themselves and it works for them. So that's just a way to train your bladder to be able to control your bladder, and then some people have to set a schedule for that. Some people go every hour, if they don't want to leak, they go every hour. Some people go every 2 hours, and that way they empty their bladder right away. All right, so that is the timing yourself when you want to void. All right, so we talked about lifestyle changes already. So you might also want to make sure that you eat lots of fiber, lots of food, drink water, to avoid constipation, lose weight if you're obese or overweight, because that will help a lot. Control your diabetes, control your A1C, which is the 3 months average of your blood sugar. Control your numbers. Make sure that you do not have uncontrolled diabetes that can lead to urinary incontinence. All right. And then we also have different types of treatment for urinary incontinence. We also have surgery. So surgery is another way, I think, when you've done everything and you can't and nothing works, and then they would advise surgery for you. And then some people, they give them a device, medical device, that they can insert into their urethra or their vagina. All right, so we do have urethral insert. All right, we do have another one called a pessary. So pessary is a ring that is inserted into the vagina, and the hope is that it would help to prevent leakage if they have a prolapsed bladder. All right, remember I mentioned prolapse or pelvic organ prolapse, when the organs such as the bladder or the womb, all right, shifts out of place. So they can put a pessary in there, they can put a urethral insert in there, and it may help. And then some people go with nerve stimulation. So when they send like electric current to the nerves around the bladder, that helps to control urination. That might be an option for that person. And then we have medication. So as I said before, there are many medications out there as well that can help urinary incontinence. Some people have take medication for overactive bladder, urinary incontinence, and it helps. All right, so there are different types of medication that could be prescribed for you if you have urinary incontinence, to help you tighten the muscles and can lessen the leakage. All right, and then as I said before, managing your chronic diseases such as the diabetes would help a lot. And for people that even after treatment they still leak urine, you have to be very careful. You have to make sure that you change your diapers often, so to prevent rash or irritation, and you use incontinence products that will help to keep your skin intact and avoid breakdown of your skin from urine touching your skin on a regular basis. All right, so as I said before, please talk to your healthcare provider, talk to your doctor, family doctor, get referred to a urologist if you need to, get referred to an OBGYN if you have to. All right, I hope this helps, and I hope now you can share this episode with friends and family and tell them about urinary incontinence and what they need to do. And I will catch you in the next one. Take care of yourself and stay safe. Bye-bye.